Well, good afternoon. My name is Amol Nirgudkar. I'm the CEO of Patient Prism. And I have with us today on our webinar my dear friend and my mentor, Fred Joyal. And most of the industry knows you, Fred, as the founder of 800 Dentist and an amazing author of two books. Everything is Marketing and Becoming Remarkable. And those were the two books that every dentist and anybody in dentistry should there be must read. If you took a college course on dentistry, these were the two books that would be recommended by your teachers. And Fred today is going to talk to us about teledentistry and telehealth overall. And Fred's an advisor to this amazing company called PatientPop, and they have just launched their new telehealth platform that applies to dentistry. So I'm totally excited about this. We're in unprecedented times today with COVID crisis kind of crippling our country and crippling our industry for the most part, where dentists are not able to see patients. They're only able to see emergencies in many states. Some states they're able to see them, but nobody's going. And teledentistry becomes a very important tool today to kind of keep the lights on a little bit for now, and maybe in the future, a way to kind of have that as a business model. So Fred, without any of my longer introductions, I want to pass it on to you and really talk and really have you explain us what is teledentistry and why now we should be paying attention to it, not just in the crisis times, but also going forward.
Well, and certainly we've heard about telehealth for a long time. And for the most part in dentistry, we've said, we need to see the patient. Dentistry is done with my hands in the practice. But the reality is we're realizing, particularly in the emergency situation that we're in now, that's not necessarily true. So it's really kind of an important time for dentists to adapt teledentistry into their practice. And I have three, I think, critical reasons why that's true. One, that patient is going to go to the ER if they don't go to you, and the ER is not going to fix it. And part two is they're going to overload a healthcare system, an ER system, a hospital system with a dental patient that they can't fix at a time when they're already overloaded. Our healthcare workers, our dentists, comrades in arms, basically on the medical side, are working crazily to hold this virus back from a tsunami of illness and fatalities. And so we want to keep people out of the ER. And the other reason is, if you go to the ER, you're leaving with the coronavirus, most likely. I mean, because that's who's in there. Or you're at least going to get the flu, because anybody with any symptoms is jammed into that that ER. So three important reasons for us to adapt teledentistry. And so PatientPop has developed the technology. PatientPop builds websites and reputation management and patient communications, all as a cloud-based utility. But so they already have access into the practice management software. And so they said, we want to develop this. And they work in all of healthcare. They work with physicians of every type, as well as dentists of every type. They said, we want to develop this process where they can do a robust level of teledentistry, not just, oh, let's get the patient on the phone and look at what's going in their mouth. Because what's happened is HIPAA was always a big issue, right? That's temporarily been suspended, but that's only temporary. Right. PatientPop has developed a system that is completely HIPAA compliant and is end-to-end in its solution. And so that's what I want to get across, that, you know, and there are other teledentistry systems out there, and some of them are very inexpensive and very simple. PatientPop, because they're cloud-based already in everything they do, this makes it easier for them to provide an end-to-end solution for a doctor. I have a theory about triaging emergency patients in dentistry, because the theory used to be, well, you got to get them all in the office. I believe that as much as a third of the patients don't need to physically come into the office, and if they did, all you would do is send them home with a prescription, because they need some pain medication right now and some antibiotics before you can even take care of them, perhaps. But you want to be able to look at that patient and say, at any time of day, and say, okay, what's going on? And it may be a chipped tooth. And it's like, this is not a problem. They can see the root isn't exposed. We can take care of this next week or whenever, in a few days or whatever. This doesn't have to be dealt with now. Or, wow, you've knocked the tooth completely out and you've got it in a glass of milk right now. Let's bring it in and let's see if we can get it to reseat. So that's, I think, the opportunity to just look at the patient and say, okay, here's what we need to do. And so it has to be, fortunately, we live in a digital world, right? So this can all be done. Everybody's got a camera on everything. And now patients are used to doing Zoom even and things like that. They understand this concept better than ever. So I think it's important that dentists adapt this at this point.
Well, I mean, obviously, the world is moving towards remote. I mean, the workplace is becoming more remote. I think medicine is going to more remote. I think eventually, as we figure out ways to control costs in healthcare, I think that so much money is wasted at the ERs for people going there for no reason except to just be sent home with a prescription for Advil. Not even that, no prescription, but just something simple.
Yeah.
The key in this always was, in telehealth, was making sure the data is private and it's HIPAA compliant. And just because right now we're in emergency, you're right. I mean, we've got to still abide by the HIPAA laws, and we've got to protect patients' privacy. So PatientPop basically has created a system that allows, you're saying, patients to engage with the doctor in a HIPAA compliant manner, right? And they're not doing FaceTime or anything. This is their internal.
No, this is so it starts with, you either are a patient. So if you put this service as part of your practice, it's going to be on your website that says you can reach me this way and actually schedule a telehealth appointment this way. Or if it's a new patient calling the practice, you can, on the phone, you can say, okay, we have an app that we're going to use, that we're going to examine you ahead of time. Okay. And then you can take the whole patient history. If it's a new patient, you can do a full patient registration, get their medical history, their allergies, their insurance information. You can get all of that right then and actually start to treat the patient. Then you have high definition imagery, two-way, where the doctor can see the patient can see the doctor. So it feels, we're at the same time on FaceTime. It feels like you and I are like we're talking to each other, basically. Right. It's no different. When the face is there, it makes a huge, very personal difference. And there's a little chat thing on the side where patients can write stuff and drop in other images. But then the dentist can figure out what's going on, what needs to be done, and actually write a prescription right there if they need to in the software, and send it and say, okay, what's the phone number of your local CVS or Walgreens or whatever? And then they can electronically send that prescription right then. And so the dentist could be doing this from wherever he or she is with a laptop. Obviously, it's better to have a laptop than a phone, but it could certainly work on a phone. So you're taking it all the way to, you can collect the money, charge either charge some of it to insurance and collect the rest, and then push the data right through to your charts. You could do electronic charting with this information because it's linked to the PMS. So,
and that's important. So there's a lot of systems out there in teledentistry that don't really integrate with practice management, and 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 that's the problem, because then you have to manually enter all this information in, and that becomes a big task. So the fact that these guys are integrated with practice management allows you potentially to even import all your patients into your into the teledentistry platform. Maybe send them emails saying that, hey, you can
yeah.
if you have emergencies or you need anything, please look at this website.
Well, and I'm telling every dentist, I'm saying your patient should have your cell number, but this would be ideal to say this. You have this, instead of giving them your cell number, you can say, I have teledentistry available for you. Contact me through this, and I will get back to you. And you can, and whether a team member is monitoring it or the dentist monitors it herself, it doesn't matter. That you're connected to the patient. You're saying, I'm here for you, which is a huge. I'm the marketing guy, right? To me, that's a very strong personal message to say, I'm here for you 24/7. And I'm trying to keep you out of the ER. The last thing I want you to do is go to the ER as my patient, because I don't want you to get the virus. You're not going to get fixed anyway. And
Right.
the hospital's
Right.
already too crowded. Don't
Right.
become part of the problem, become part of the solution.
Right. The main thing, I think, with right now, I'm reading this all over the place where insurance companies, dental insurance companies, are reimbursing for teledentistry consults.
Yeah.
And that, and at least for a 90-day period while this is going on. Do you think, Fred, that this will continue? They will continue reimbursing?
Absolutely. It's a way to deal with emergencies in a very efficient way. They have codes for it, D9995, which is real time, and D9996, which is asynchronous, whereas the doctor's reviewing the information afterwards that maybe a team member has gathered. So the ADA has put out codes, and you can charge $75 to $150 for a 5 or 10 minute visit. And as you said, this may be a way to keep the lights on during this time. But to me, that's only part of it. The other part is you're taking care of your patients. You're there for your patients, and you're there for people who don't have a dentist right now. You're keeping them out of the ER and maybe turning them into a long-term patient because you were there for them in this extreme time of need, where even if they went to the ER, how many hours would you wait before somebody told you they couldn't do anything for you?
I think I'm hearing from you as well is that you could potentially do other things besides emergencies with teledentistry. You could look at aligners. You could look at somebody's just chipped tooth. I mean, there could be a lot of applications of this, not just only emergencies.
Yes, of course. When you've got good high definition imagery, you can certainly do some level of a patient examination. If when the dust settles on all this and we get back to what the new normal is,
right.
We will be doing veneers, we will be doing whitening, we will be doing implants, we'll be doing braces, of every type. And we're going to be able to do a very personal exam that takes 5 minutes, and you don't worry about the patient not showing up for it because all they have to do is sit down and turn on their computer. And so to me, we're going to find this becomes a permanent part of the practice as a way of taking care of your existing patients, but also attracting new patients. It's going to have a long-term value in the practice. So adapting this now is a critical skill, but it's also going to become integral, I think, long-term.
Yeah, I agree with you. I think there's a lot of organizations we're working with right now, a lot of dental practices that are actively using teledentistry to recruit new patients in their ads, for example.
Yeah.
Like, hey, we can see you, and I know you can't come into the office, but there's Google ads and Facebook ads going out in the community, touting that they can see them today through the teledentistry portal.
Well, and this is my recommendation also to dentists who are considering this, is that there are people out there who are out looking to attract your patients. If you don't see them for emergencies, they're going to take advantage of this by being there for them. Now, I think it's, maybe it's a little bit evil that that's what they're doing, but at the same time, they're providing a service that other dentists have decided not to. So how much are they to blame? It's the reality is that this is all there is right now. 800 dentists right now has tens of thousands of emergency calls a day. All right. Emergencies, that's all they are getting. But right. That's the reflex. 800 dentists now is a resource to people because they think of it, and I'm not directly involved with the company anymore, but I'm talking to them and they said, we've actually set up an emergency membership, emergency only membership, because there's so much of this volume. If dentists are willing to handle particularly evenings and weekends, we have patients for them. So you could be building your patient base. I was talking to a dentist who, she just opened her practice when this hit. And she said, I don't know what I'm going to do. And I said, I know what you're going to do. You're going to take every single emergency that possibly can come your way, triage them through teledentistry, and treat anyone you can. Whether you have to go into your office by yourself or you have one assistant with you, and join this emergency program, because the need out there is for emergencies. And my personal dentist, he's doing 6 or 7 root canals a day right now. So because that's what most emergencies are in reality is, and then when you can complete and restore, do a root canal and restore it all in one visit, that's good money. You can ride this out, this 2, 3, 4 months and of whatever's going to happen, where we're mostly closed, and then the slow comeback, because we're going to come roaring back with what? More emergency patients. We're going to, because dentistry just gets postponed. We don't lose out on it. It just moves down the line. So we're going to be doing tons of that before we get back to the more cosmetic side of dentistry.
So quick question. This looks like a no-brainer, obviously. Especially now, for sure. What's the setup and what's the cost?
So what I'm doing, because PatientPop handles all of healthcare, I've created a portal through my website where it'll go to somebody who knows you're coming through the dental world and on the dental side, and they'll have people trained to talk to you about a dental practice. So going through fredjoyal.com/PatientPop, you'll be able to just put in your information to get a demo. Somebody will contact you, and you can talk about how to set this up. But it's really easy. It's a downloadable app. It's, there's stuff you can attach to your website. But the training on it's very simple. It's just a matter of, it's no different than joining other communication services. It's fairly simple, and it's doing what you normally do in a digital way, just slightly differently. So there isn't like 3 hours of training. It's more like 20 minutes to get good at it.
That's important. Obviously you have the time now to do this, but I think getting this done and you could start next day or even the same day, which is amazing. You could start marketing.
Right. You could be going. You could be talking to patients that afternoon or that evening. Which is what you want, and have a team member understand how it works as well. So I recommend jumping on it, because it's a few cases will pay for it. You don't have to be a PatientPop customer. If it's less expensive if you have your website and reputation management with them, but they have it as a standalone product as well. And it is the most robust product on the market that I've found. There's great stuff out there. There's simple stuff that you can get started with, but in terms of an end-to-end comprehensive solution, this is the thing.
We're going to leave the information about how to contact PatientPop through Fred Joyal's URL link. That's on the screen as we see. And obviously, Fred's always happy to answer questions. You can email him. We're going to leave his email on the screen as well.
Yes.
While everybody's going through these tough times, people have questions about marketing or anything else. Fred's always available to answer them. Connect with him through social media, connect with him by email. And then obviously teledentistry is something that we definitely are telling our customers that you've got to have this. This is not just now, but the future of dentistry as well. I understand you can't do most things, but you can do many things, at least in the emergent side, using this platform. Thank you, Fred, for joining us in this wonderful discussion. As always, it is an honor and a pleasure to talk to you.
Thank you, Amol.
We will continue being safe, being inside, and being responsible citizens so that we can get rid of this crisis once and for all and get going and back to the dentistry that we love. So thank you again.
Thank you, Amol.